microbiology, that is on Friday. Okay, so Friday I'll be taking the class the same time 9:30 to 10:30. अनि वेडनेसडे चाहिँ डक्टर खनाल सरले माइक्रोबायोलोजीको खनाल सरले लिनुहुन्छ है गोनोरिया टपिकमा। तिमीहरूको सिआरको दिपिका हो अहिले?
हजुर म्याम।
दिपिका तिमीहरूको अब ग्रुपमा पनि यसो सेयर गरिदियो है इन्फर्मेसन चाहिँ। वेडनेसडेको मर्निङ 9:30 to 10:30 चाहिँ माइक्रोबायोलोजीको खनाल सरको क्लास हुन्छ है। अनि फ्राइडे चाहिँ फार्माकोलोजी क्लास हुन्छ है मेरो 9:30 to 10:30।
हुन्छ म्याम।
ल आई थिङ्क अब अलिक स्टुडेन्ट्सहरू त आयो होला नि 75। ओके आई थिङ्क विल स्टार्ट हो कि अदरवाइज फेरि क्लास दिँदैन। So today we'll be discussing drugs related to the female sex hormones. Okay, before going to the female sex hormone, I mean drugs. Okay, we'll discuss the physiology of the female sex hormones, and then we'll go with the drugs related with the female sex hormones. Okay, so you know what are the female sex hormones, right? They are mainly the estrogen and progesterone. Okay, and they are the most important hormones. They are mainly secreted by the ovaries. Okay, and they plays the vital role in maintaining the reproductive system of the female, right? So in female sex hormones, the hormones are mainly estrogen and progesterone. Okay, and ovary is the major site for the secretion of the estrogen and progesterone, isn't it? And as for pregnant women, usually fetoplacental unit is the major part for the secretion of progesterone and estrogen. Okay, and there are other peripheral tissues also that secretes the estrogens like liver, kidney, brain. Okay, and progesterone is also secreted by the corpus luteum and placenta. Okay. Okay, now let's go with the estrogen first. Okay. Estrogen, there are usually three forms of natural estrogens. Okay, that is estradiol, estrone, and estriol. Okay, estradiol is the potent estrogen that is mainly secreted by the ovaries. Okay, and it is maximum or abundant in premenopausal women. Okay, whereas estriol is the weakest estrogen, and estrone, it is mainly present. Okay, the estrone is mainly present in the male and in cases of postmenopausal women. Okay, in premenopausal estradiol form of estrogen is maximum present. So there are three form of estrogens. Okay, estradiol, estrone, and estriol, and estradiol is the most potent estrogen. And as for the synthesis of female sex hormones, okay, they are mainly synthesized from the cholesterol. Okay, like other aldosterone, hydrocortisone, also they are also from the cholesterol. Okay, both the estrogen and progesterone, they synthesize from the cholesterol. Okay, and they form the androstenedione and testosterone, which with the after the aromatization of this testosterone, this estradiol is formed. Okay, and all those estrone and estriol is also synthesized. So you must remember that there is after the aromatization of this testosterone, this estradiol is formed. Okay, so because we have got drugs that inhibit this aromatization and inhibit the action of estrogen. Okay, now next important is the regulation of the secretion. Okay, so for the regulation of the female sex hormones, okay, there is again the same axis that is present, that is hypothalamus pituitary ovary axis. Okay, which has a feedback mechanism. So hormones and hypothalamus, okay, they regulates the pituitary gland, pituitary hormones, okay, secretion. Usually what happens, okay, the estrogen and progesterone, okay, estrogen and progesterone, they inhibit the secretion of FSH and LH from the pituitary hormones, okay, and gonadotropin releasing hormone from the hypothalamus, okay. And this pituitary hormone, okay, when there is less estradiol and progesterone, okay, then what happens? There is increase in secretion of gonadotropin hormones and luteinizing hormone and follicle stimulating hormone that will cause the synthesis of ova, okay. Ovulation will occur, and then there is again secretion of estrogen and progesterone. So again, once there is estrogen increases, again it inhibits the secretion of the hormones from the hypothalamus and pituitary. So this axis maintains the positive and negative feedback mechanism for the secretion of female sex hormones. Okay. I think, have you been taught in physiology about these female sex hormones?
Yes, ma'am.
Okay. Okay, this does the revision for you all. Okay. Uh, Now the next important is again the change in the plasma level of hormones and also the uterine morphology during the menstrual cycle and ovarian cycle. Okay, so I'll just go briefly. Okay, in ovarian cycle there are mainly three phases, that is follicular phase, okay, ovulation phase and luteal phase. Okay, ovulation, follicular phase, ovulation phase and luteal phase, isn't it? So follicular phase means usually there is a growth of follicles with the help of follicular stimulating hormones, okay, and during that phase again estrogen starts secreting, right, and then on this estradiol, okay, they stimulates the LH cells, okay, and by which there is rupture of the ovary and there is a release of the ova, okay, that is called the ovulation. And after ovulation there is a luteal phase where there is formation of corpus luteum, okay, this luteinizing hormone, okay, it stimulates the corpus luteum to secrete the progesterone. So that is the luteal phase, okay. So initially there is a follicle stimulating hormone secreted by which there is the growth of the follicles take place, okay, and then after that there is luteinizing hormone starts, okay, with the help of estrogen, okay, then that will cause the ovulation, ova is released, and once the ova is released, okay, the corpus luteum, there is a formation of corpus luteum which is stimulated by mainly by the luteinizing hormone, okay, and once the corpus luteum is formed there is a secretion of the progesterone hormone, okay. So that is the ovarian cycle. Now at this phase there are again changes that occurs in the uterus, okay, that is called the uterine cycle. So in uterine cycle again it's again there is a proliferative phase, okay, different phases are there, that is the proliferative phase, secretory phase and menstrual phase, right. So proliferative phase means के हुन्छ uterus मा usually the estrogen, okay, they stimulates the mitosis, okay, there is a regrowth of the blood vessels and there is a production of the progesterone hormone, okay, during the proliferative phase. Then there is a secretory phase where there is a endometrial thickening, okay, and there is a secretion of the fluid and accumulation, and that occurs mainly because of the progesterone, okay, and this at this phase, secretory phase, it helps for the embryo to implant, isn't it, for the development of the embryo, okay, during the secretory phase, which is mainly done by the progesterone hormone, okay. But if there is no fertilization, okay, no implantation, what happens? Since the corpus luteum starts degenerating, there is no further secretion of progesterone, okay, the level of the progesterone will decrease. So what happens? There is a contraction of the arteries, okay, and there is ischemia of the endometrium which leads to the bleeding, okay, and that is called the menstrual cycle. So there are at different phases, okay, the hormones acts, okay, and have the uterine cycle and ovarian cycle, okay. Now the mechanism of action of these hormones, okay, estrogen and progesterone, they both are the steroidal chemical structure like other steroid hormones, okay, like hydrocortisone, testosterone, okay, and the receptors of this estrogen and progesterone receptors are hormones are the estrogen receptors alpha and estrogen receptor beta. Similarly, for progesterone receptors, they are progesterone receptor alpha and progesterone receptor beta. Okay, so the receptors are called alpha and beta for estrogen and progesterone. And as for distribution of these receptors, okay, estrogens alpha, they are mainly present on the uterus, okay, vagina, breast, hypothalamus, pituitary, and blood vessels, whereas beta is mainly present in the prostate gland in males and ovaries in females. Similarly, progesterone, it is present in the female genital tract, breast, pituitary gland, and CNS. Now the mechanism of actions, okay. Okay, so like other steroid hormones, okay, the receptors are also present in the cytoplasm. Okay, for estrogen and progesterone, the receptors are present in the cytoplasm. Okay, so after simple diffusions, okay, they enter into the cells. Okay, this estrogen and progesterone, they enters into the cells and they binds to their respective receptors, and that makes the complex. Okay, so estrogen preparations, they also, as a drug, they also make complex with the estrogen or progesterone receptors. Okay, so once they form the complex, they are transported inside the nucleus. Okay, they enters into the nucleus and then it binds to the DNA, specific site of DNA, that is called respective hormone response element. Okay, in the DNA to their respective hormone or to the respective hormone element. Okay, it binds, the complex binds, and that will help to induce the synthesis of mRNA, and this mRNA again transport into the cytoplasm, which helps to regulate the protein synthesis and will cause the cellular effect. Okay, depending upon the tissue it acts. So you can see in this picture, that is from the Lipin cord. Okay, this estrogen receptors, and this is the steroid hormones, or it can be also the drugs. Okay, that binds to the estrogen receptors. Okay, and they forms the complex. Okay, and that will after the drugs or the estrogen, it binds. Okay, it uncovers its DNA site. Okay, so that it can easily bind to the DNA. Okay, so after making a complex, okay, it goes inside the nucleus and binds to the DNA. Okay, so along with the coactivators, okay, it will regulate the gene transcription. Okay, so mRNA synthesis is formed. So mRNA again it transports into cytoplasm and regulates the synthesis of the protein that will have the cellular effect. Now let's go with the actions of estrogen. Okay, for the progesterone also the mechanism of action is similar. Okay, progesterone company, progesterone, they binds to the progesterone receptors and forms the complex which goes inside the nucleus. Okay, and binds to its respective response element, and along with the coactivators, okay, it regulates the gene transcription. Okay, so now let's see what are the actions of estrogens. Okay, now you must be knowing, okay, the actions of estrogens. Okay, and they mainly, estrogen and progesterone, they mainly plays the vital role in maintaining the reproductive system in female, isn't it? So in the female reproductive system, okay, this estrogen, okay, in fallopian tube, uterus, and vagina, okay, they cause the pubertal growth and development, okay, proliferation of uterine endometrium, and thickening and cornification of the vaginal epithelium. Okay, similarly in mammary gland, it causes pubertal growth, okay, proliferation of the duct and stroma, and in the cervix, it helps to increase the water secretion. Then apart from female reproductive part, it also has action in the other system. Okay, So as for metabolic effect, it increases the HDL, okay, and decreases the LDL and increases the triglyceride, okay. So estrogen, it increases the HDL and LDL ratio, okay. So that is the benefit of the estrogens, that prevents from the atherosclerosis in premenopausal women, okay. That is the advantage. So in premenopausal women, there is a less chances of forming atherosclerosis, okay. And next is that in high dose of estrogen, they can impair the glucose tolerance, okay. So it can cause hyperglycemia, and also estrogen can cause salt and water retention, which can lead to edema, okay. So with the actions of these drugs, if you remember, you can say their advantage and or adverse effects of the drugs also, okay. Next, the in the bone, okay. So estrogens, okay, they causes fusions of the epiphysis of both male and female, okay, for girls as well as in the boys. And also it maintains the bone mass by retarding the bone resorption, okay. So it has a direct favorable effects on the bone remodeling, okay. And mainly it causes the apoptosis of the osteoclast. Next, in blood, okay, it has been found that estrogen, it increases the blood coagulability, okay. So that's why there is a high chances of thromboembolic predisposition, okay. And it is because of the induction of the synthesis of clotting, various clotting factors, mainly 2, 7, 9 and 10, okay. And also it has been found that estrogen, it increases the fibrinolytic activity due to the lowering of plasminogen activator inhibitor, okay. And others, like also it has the there is a distribution of growth as per female pattern, okay. So these are the actions of estrogen, okay. So one of the adverse effects, common adverse effects of estrogen is also it can cause thromboembolic disorder, okay. Now next is the action of progesterone, okay. That also progesterone is also the main part for the maintaining the reproductive part of the female, okay. So it also helps in growth and development of the fallopian tube, uterus and vagina, okay. It induces progesterone, okay. We are talking about the progesterone now. It induces the secretory phase of the estrogen primed uterine endometrium, okay. So progesterone, it mainly acts when after the proliferative phase of the endometrium, after the estrogen has act on that uterus endometrium, okay. And in pregnancy, okay, there is a decidual changes that occurs in endometrium and which helps for the maintaining the pregnancy. So progesterone is very important for maintaining the pregnancy, okay. Next, in mammary gland, there is the epithelial proliferation and turnover that occurs mainly during the luteal phase, okay. And along with the estrogen, okay, there is development of the alveolar secretory system of the breast for the lactation. And in the cervix, it causes viscous and scanty mucus secretion, okay, which helps in barrier for the sperm penetration. And as for metabolic effect, it is progesterone, it decreases the HDL and increases the LDL. It also impairs the glucose tolerance, okay. During the luteal phase, there is increase in slightly increase in body temperature, and it is because of the progesterone. And in the CNS, it can change the mood of the female, okay. Okay, so these are the actions of the estrogen and progesterone. Now we'll go with the drugs related with the estrogen and progesterone. First, let's discuss with the estrogen preparation and then antiestrogens, and then we'll go with the progesterone and antiprogestins, okay. So as for estrogen preparation, we have got natural estrogen preparation as well as synthetic and semi-synthetic estrogen preparation. Okay. So natural estrogens, we have got estradiol, benzoate, okay, cypinoate, enanthate, valerate. Okay, these all are the estradiol preparations that is available in intramuscular injection as well as intramuscular depot preparation. Okay, depot preparations, these are the type of preparations which are injected intramuscularly and they act for the longer period of time. Then as for natural estrogen, we have got estrogen preparation as well, and then we have got estriol succinate, okay, which are in oral form as well as in vaginal cream form. Okay. Then as synthetic steroidal estrogen, we have got ethinyl estradiol, mestranol, and tibolone. Okay, mestranol is the prodrug of ethinyl estradiol. Then we have got synthetic. So ethinyl estradiol, okay, mestranol, these are the steroidal preparation of estrogen. Okay, whereas synthetic, there are non-steroidal estrogen preparations also. We have got diethylstilbestrol, exestrol, and dienestrol. Okay. And next important is the conjugated estrogen. That is the new preparations which are in tablet as well as injection and vaginal cream. Okay, conjugated estrogens. It is actually the mixture of the sodium estrone sulfate. It is the mixture of the sodium estrone sulfate and sodium equilene sulfate. And this sodium equilene sulfate is the natural estrogen that is derived from the pregnant mare. Okay. So conjugated estrogens, they are most commonly used in cases of postmenopausal women, okay, to decrease the symptoms that occurs during the postmenopausal. Okay. So conjugated estrogens, they are the mixture of the sodium estrone sulfate and sodium equilene sulfate. Equilene sulfate, it is the natural estrogen that is derived from the pregnant mare. So as for dose of the estrogens, okay, different preparation of the estrogens, okay, parental preparation, you can see estradiol, okay, is more potent, 0.1 mg, whereas diethylstilbestrol, that is 10 mg. So the dose of this 0.1 mg is equivalent to diethylstilbestrol of 10 milligram. Okay, similarly, ethinyl estradiol 0.1 mg, mestranol 0.15 mg, conjugated 10 mg, and ethinyl succinate 16 mg. And diethylstilbestrol is 10 mg. Okay, so dose of the drugs varies. Now pharmacokinetics. Okay, these natural estrogens usually they are inactive orally because they have got a high first pass effect. Okay, so usually synthetic preparations are active orally. Estradiol converts into the weaker form of estrone and estriol in the liver and other tissues. Okay, and these all three forms, they get conjugated in the liver and excreted in bile and urine. Okay, so this is how these estrogen preparations or estrogens are excreted. Okay, and again the conjugated metabolites. Okay, once they are conjugated, they goes excreted through the bile. Okay, and enters into the intestine. And in the intestine, again, they get deconjugated and some of them undergo again into enterohepatic circulation. Okay, that is the pharmacokinetic property of the estrogen preparation. Now, okay, uses of the estrogens. So there are different uses of estrogens. Okay, one of the common use of estrogen is as an oral contraceptives. Okay, next in cases of postmenopausal hormonal replacement therapy, in delayed puberty in girls, okay, senile vaginitis, dysfunctional uterine bleeding, dysmenorrhea, acne, and carcinoma of prostate. Okay, so one of the important indication of estrogen is for the contraceptives. Okay, what do you understand by contraceptives? They are the method to prevent the pregnancy. Okay, so estrogens along with the progesterone are used for the oral contraceptives. So you will have a different lecture class for the hormonal contraceptives. Okay, and how this estrogen prevent pregnancy. Okay, this estrogen, they inhibit the ovulation along with the progesterone. Okay, they inhibit the ovulation. Okay, as you know, there is a about the feedback mechanism. Okay, when estrogen is given, what happens? There is a inhibition of the follicle, inhibition of the secretion of follicle stimulating hormone and luteinizing hormone. So that will lead to inhibition of the ovulation. Okay, so that will prevent from the pregnancy. So that will be again discussed in more detail. Okay, about this hormonal contraceptives in coming classes. Okay, there will be separate class for hormonal contraceptives. So next we'll be discussing on the postmenopausal hormone replacement therapy and other indications of estrogens. Okay. So in postmenopausal, what do you understand by postmenopausal symptoms? Okay, postmenopausal symptoms are the symptoms that occurs after the menopause. Okay, so menopause means cessation of the menstrual cycles. Okay, which occurs in the mid age. Okay, that is around 50. Okay, after 50 years or 45 to 50 years. Okay, so after the menopause, okay, there are various symptoms that occurs in women, that is called postmenopausal symptoms. Okay, and it is because of the cessation of the ovarian functions. Okay, the ovary stops functioning. So all the symptoms occurs in the woman. So after the menopause, only 10% of estrogen is secreted by the body. Okay, so there are various symptoms that occurs like osteoporosis, vasomotor symptoms, okay, cardiovascular symptoms. It can cause atrophy of the urinary genital tract and other neurological symptoms. So apart from menopausal women, okay, patients who had undergone bilateral oophorectomy, that means removal of the both the ovaries, they can also have these symptoms, okay, like a postmenopausal symptoms, because it occurs due to the cessation of the ovarian function. So this therapy is called postmenopausal hormone replacement therapy. Okay, so usually not only estrogens, we also give progesterone along with the estrogen. So as for osteoporosis, okay, choice of estrogen preparations are the conjugated equine estrogens or transdermal patch of the estradiol. Okay, so this prevents from the bone loss, okay, and increase in bone density. And also, but however, it cannot restore the bone loss which has already occurred. Okay, so in osteoporosis, it further prevents from the bone loss and also increases the bone density. And as estrogen alone, when given, it can cause endometrial carcinoma. So always when we give the therapy of estrogen, we have to follow with the progesterone, okay, for 7 to 10 days. So that will prevent from the endometrial carcinoma. So other drugs that are used in osteoporosis are the calcium with vitamin D, raloxifene, which is the estrogen selective estrogen receptor modulator that we'll discuss, okay, and you must be knowing bisphosphonates, right? These are the other drugs that are used in osteoporosis. Next symptom is the vasomotor symptom, okay, where there is hot flushes, sweating, paresthesia, and pain, okay, and usually it occurs for the first 2 to 3 years. So drug of choice are again conjugated equine estrogen, that is the estrogen preparation, along with the hydroxyprogesterone acetate, which is the progesterone preparation, okay, for vasomotor symptoms. And as for cardiovascular symptoms, okay, there is a high risk of coronary artery disease occurs after the menopause. Okay, there is a high trial rate of trial that went through estrogen preparations. Okay, given for these cardiovascular symptoms in cases of postmenopausal women. But however, the treatment was not very effective. Okay, because it further increase the risk of gallbladder, breast cancer, and myocardial infarctions. Okay, so cardiovascular disease ko lagi we have to go with the drugs that is related with the cardiovascular disease. Okay, then as for urogenital atrophy, okay, after the decrease in secretion of this estrogen, okay, there is a atrophy of the genital tract that leads to the frequent infections, okay, and also can cause vulvitis and senile vaginitis. Okay, so for that again we can give estrogen preparation either orally or topically, and progesterone by oral route. And some patients also may have these neurologic symptoms like insomnia, fatigue, okay, and migraine headache. Again, in these conditions also estrogen preparations like conjugated estrogen or estradiol are given to improve these symptoms. Okay, so this is the management of for the menopausal symptoms. Okay, postmenopausal symptoms. Now next, in cases of delayed puberty in girls. Okay, so in some girls there may be a delayed puberty and it occurs due to the ovarian dysgenesis or hypopituitarism. Okay, so here again, okay, this in both cases of ovarian dysgenesis and hypopituitarism, okay, the treatment usually starts at the age of 13 to 14 years. Okay, so here the small dose of estrogen is given initially, like ethinyl estradiol, okay, for 3 weeks, every month for 4 months. Okay, and then the dose is decreased for again next 3 weeks every 1 month for 1 year. Okay, so usually it's starting with the low dose of estrogen, okay, for 3 weeks every month or 4 months, and then again 0.2 mg for 3 weeks every 1 month for 1 year. Okay, so once estrogen is given, okay, there is a changes in the pubertal and sexual characteristics. So once these characteristics develop, then we can add the progesterone. Okay, this progesterone should be added during the last week of the every month. Okay, 3 weeks estrogen, only 1 week say progesterone then. So what happens, that will cause the menstrual bleeding. Okay, did you get that? So for the delayed puberty, estrogens and progesterone is given. So along with that also we have to give androgen and growth hormones to promote the height and other normal growth. Okay, okay, now next indication of estrogen is in cases of dysfunctional uterine bleeding. Okay, so dysfunctional uterine bleeding, in this condition, okay, without any cause there is bleeding. Okay, so along with progesterone again we can give the estrogen. And for the recurrence conditions we can give the combined form of contraceptive pills. Okay, some contraceptive pills, there is a combination of estrogen and progesterone. So those type of preparations can be also given for the dysfunctional uterine bleeding. And usually this progesterone, okay, norethindrone, they are given cyclically to prevent the prolonged bleeding. Next, in cases of dysmenorrhea, though estrogen is not the first choice, okay, usually the NSAID is the choice of drug in cases of menstrual dysmenorrhea. Okay, so you know dysmenorrhea, it is the pain during the menstrual bleeding. Okay, and it occurs when there is increase in prostaglandin from the endometrium. So NSAID is usually the choice of drug for the dysmenorrhea. And acne and carcinoma of prostate, again less use of estrogen is there. Okay, and acne, it is usually seen due to the production of increased androgen secretion. Okay, this estrogen, it suppresses the ovarian production of androgen by inhibiting the gonadotropin releasing from gonadotropins from the pituitary gland. Okay, and these estrogens, they are usually used topically in girls. Similarly, in cases of carcinoma of prostate, okay, estrogens are used as a palliative treatment, that is a symptomatic treatment. Okay, and it suppresses the androgen secretion from the pituitary gland. So these are the indication of the estrogens. Okay, now next is the adverse effects of estrogen. So in female, it can cause headache, okay, nausea, irregular bleeding. Okay, it can cause endometrial hyperplasia, which can further cause endometrial carcinoma. Okay, then estrogen also can cause breast cancer. They can cause vaginal and cervical cancer in cases of female offspring if taken in by the mother, okay, during pregnancy. And also estrogen, it can worsen the endometriosis. Endometriosis, it is a condition where the endometrium cell is lining is there beyond the uterus. Okay, and in male, it can cause gynecomastia, feminization, and decreased libido. And in both, okay, there is, if estrogen is given, okay, it can cause early fusion of the epiphysis, okay, which can decrease the adult stature. And other, it can cause gallstone formation, okay, gallbladder disease, hepatic dysfunctions. Okay, it can predispose to thromboembolism and fluid retention. Okay, in both male and female. Okay, any question till now? I hope everyone is getting the point. Okay, these are the adverse effects of the estrogen. Now next is the contraindications. Contraindications, you should know the contraindications also, because estrogens and progesterone, they are commonly used mainly for the contraceptive purposes. Okay, so contraindications in the in pregnancy, as we have seen. Okay, in pregnancy, it can in female, if the female offspring is there, then it can cause the cervical and vaginal cancer. Okay, and then other contraindications of estrogen is in case thromboembolic disorders. Okay, diabetes, as it can cause hyperglycemia, hepatic failure. Okay, then it is also contraindicated in cases of estrogen dependent carcinoma of breast. Okay, endometriosis, and undiagnosed case of vaginal bleeding. Okay, so if there is the cause of the vaginal bleeding is not known, we should not start the estrogen to stop the bleeding. Next is the drug interactions with the estrogen preparations. Okay, so this is also very important. Okay, enzyme inducers like rifampicin, phenytoin, okay, carbamazepine, okay, they increase the metabolism of the estrogen. Okay, so that will decrease the effect of the estrogen. Okay, so like for example, if the estrogen is given for as a contraceptive purposes, what happens if these drugs are given along with this estrogen preparation, then the contraceptive failure occurs. Okay, because rifampicin, phenytoin, okay, These are rifampicin. I hope you know. Okay, it's antitubercular drugs. Phenytoin, carbamazepine. They are the anti-epileptic drug. Okay, given for epilepsy. These drugs they increases the metabolism of the estrogen, and that will decrease the or cause the failure of the contraceptives. Okay, then next, okay, for the if the patient is using insulin or hypoglycemic drugs, okay, uh, and the estrogen preparation is given as it causes hyperglycemia, the effect of these drugs may decrease. Okay, so we have to increase the dose of the insulin and hypoglycemia. And some antimicrobials, okay, what it does, it kills the flora of the intestine, which will inhibit the intrahepatic circulation of the estrogen. So the dose of the at this phase also the dose of the estrogen has to increase, otherwise the effectiveness of the estrogen will be decreased. Okay. Okay, so this is about the drug interaction with the estrogen. Okay, any question till now? Now, so now we have to go with the anti-estrogen also. Okay, so we'll discuss this anti-estrogen also. This is very important. Okay, that is a clomiphene citrate. It has been repeatedly asked, okay, in the exam about the clomiphene citrate. This drug is mainly used for the infertility patient. Okay, so you might get the PVQ related with the infertility. Okay, and asked about the questions or asked about the drugs given in those type of patient. Okay, so clomiphene citrate, it is the anti-estrogen. Okay, so there are other anti-estrogens, but they are not total anti-estrogen, but they are called selective estrogen receptor modulators. Okay, because they have got the partial agonist and antagonist action in the estrogen receptors depending upon the different tissues. Okay, in some tissues they have got the agonist action, and in some tissues they have got the antagonist action. So that's why they are called selective estrogen receptor modulator. Okay, so today we'll discuss on the clomiphene citrate. I think we'll complete only clomiphene citrate, and next time we'll discuss on the selective estrogen receptor modulator. Okay. So clomiphene citrate, it has got the antagonist action on both estrogen receptors, that is alpha and beta. Okay, and also it acts as a competitive antagonist in the hypothalamus. Okay, so the mechanism is that what happens, this clomiphene citrate, it blocks the estrogen receptors, okay, in the hypothalamus, okay, that fails to cause the estrogen negative feedback mechanism. Okay, so that will release the gonadotropin releasing hormone from the hypothalamus. Okay, did you get that, the mechanism? So clomiphene citrate, okay, it inhibit the estrogen negative feedback mechanism. Okay, so that will increase the gonadotropin releasing, increase the secretion of gonadotropin releasing hormone. So once there is increase in gonadotropin hormone release, okay, there is increase in secretion of follicular stimulating hormone and luteinizing hormone. Okay, so once these hormones are released, there is increase in ovaries enlarges, and that causes the ovulation. Okay, did you get the mechanism? This clomiphene citrate is very important. It has been frequently asked in the short notes and also in the PBQ and also in the MCQs also. Okay, so please make sure that you understand the mechanism of clomiphene citrate. So uses of clomiphene citrate in cases of female infertility. Okay, so it facilitates the ovulation. Okay, mainly in cases where the ovary is normal. Okay, but it is not effective in cases of primary ovarian failure or pituitary failure, because what happens if the pituitary failure is there, there is no secretion of the FSH and LH, and if there is ovarian ovary itself is defective, then there is no ovulation. Okay, so the ovary and pituitary glands would be normal. Okay, and for the female infertility, okay, apart from clomiphene citrate, other drugs are also available to induce the ovulation. Okay, that you must be have been already taught about the gonadotropin preparations, that is menotropin, urofolitropin, okay, and gonadotropin releasing hormone agonist and antagonist. They are also used for the infertile patients. Okay, and they are used for the assisting the reproduction. Okay, for in vitro fertilization, okay, to mature the oocytes, isn't it? Next, also in male infertility, okay, clomiphene citrate can be given, okay, to promote the testosterone secretion, and that will lead to the spermatogenesis. Okay, and as for in vitro fertilization, along with the other gonadotropins, okay, it helps to improve the maturation and harvesting of the ova. Okay, so now the adverse effects of clomiphene citrate. So adverse effects are, it can cause multiple pregnancy. Okay, as there is increase in ova released. Okay, number of usually one ova is released, okay, during its ovulation, but this clomiphene citrate, it causes multiple ova are released during by this clomiphene citrate. Okay, so there is a high chances of multiple pregnancy. Okay, and also it can cause polycystic ovaries. Okay, cysts are formed, and then it can cause hot flushes, gastric upset. It can cause alopecia and vertigo, which are reversible, okay, once the drug is stopped, and also it can lead to ovarian tumor. So these are the adverse effects of clomiphene citrate. Okay, so I will stop here. It is already time. Okay, I haven't taken your attendance. Okay, please wait, don't leave. So next class will in next class we'll go through the remaining selective estrogen modulators and the progesterone preparations. Okay. There is some problem that is going through this downloading the attendance. What you can do is, Deepika, we have got 81 strains are there, right? So can you send me the name of the absentees? Because other are also doing the same thing for me. Okay, because attendance the download भइरहेको छैन मेरोबाट, I don't know अरूमा के भइरहेको, and I have been asking the CR to submit the absentees list. अहिले पनि भइरहेको छैन. Can you send 81 of them are there, so 100 जना हुनुपर्ने हैन?
हजुर म्याम.
Yeah, so I need 19 students name, okay, absentee students name. Can you do that? तिम्रोकोमा थाहा हुन्छ?
म हेर्छु म्याम, हुन्छ होला.
Will it take some time? Will it take time?